stage. So the first thing we knew is it was roughly a 60-year-old woman who had been hit by the first thing that you notice about her is she has some severe orthopedic injuries. One leg is nearly severed.
Hello and welcome to Med Talks with Dr. Moin. Today we have an eminent emergency physician, Dr. Seema. Good morning, Dr. Seema.
Good morning, sir.
Ma'am, can we have 2 minutes of your precious time?
Yes.
We are going to talk to you so that we get some answers for our viewers about the Department of Emergency Medicine and what you guys do. Ma'am, I have been seeing this first, second, third wave, and I have seen you how people have been fighting against all those viruses and the recent novel coronavirus COVID-19.
Yes.
Ma'am, can we just talk about your achievements and about your struggle and your past memories with first, second, and since the state government has said that the third wave has ended,
Yes.
so can we just talk about it, ma'am?
Sure.
Over to you, and I follow you, ma'am.
We do the triaging as well. Triaging is nothing but we sort out the patients
Okay.
where we need to keep.
Okay.
I'll show you the stickers over there. You can see
Okay.
the triage area, the red one.
Okay.
So, can you come here?
Yes, ma'am.
Red indicates that it is the highest priority, the first priority to be given to the patient.
Okay. This one, right?
Yeah.
Okay. Fine. Okay.
So we tend to keep the patient here. The fourth and fifth beds,
Okay.
that is the highest priority, priority 1.
Okay.
The next comes priority 2, that is yellow.
Okay.
So
So-
just like example, like fracture, long bone, like femur
Okay.
fracture or something.
Okay.
Okay, but patient is not that sick, but
Okay.
can become sick. We never know.
Okay.
So we tend to try it like that.
Somebody who's requiring in emergency,
Yes.
like cardiac patients, and somebody who needs oxygen,
Yes.
you just give them that red zone.
Red zone.
And somebody who doesn't need that kind of treatment,
Then you keep it in yellow.
yellow zone.
And then another priority. This is a green.
Okay. This is green.
Yes.
Okay.
Priority 3.
Okay.
And where the patients seem to be stable.
Okay.
Okay, they require like high grade fever or something.
Mhm.
They're stable.
Okay.
And we can keep them safely. So we tend to keep the patient here.
Okay.
This is how we channelize the patient
Okay.
so that there is no clogging of the patients.
Okay.
That is how we do the triaging.
Oh, that's fantastic. So, going to talk to Dr. Seema Sunil Pulla, who is head of the department in Care Hospital of Nampur. So, yeah, thank you so much, ma'am, for giving us your valuable time.
Most welcome.
You are an emergency physician, right?
Yes.
What do they call him, ma'am?
Emergency physician.
Okay. Since we are in your safe zone, maybe you can remove your mask and we can. Is it okay? I think this is the safest zone.
Yeah, sure.
Yeah. Thank you so much for the time, ma'am, you are sparing for our viewers. Ma'am, during this first, second, third waves of COVID, can you just share us your experience? Like, how did you just manage all these 3 waves?
Yeah, the beginning of the first wave was very challenging.
Okay.
We didn't know anything what is happening. I think it was challenging for the entire world and all the doctors.
Okay.
So first wave, we didn't even know what were the protocols, and we didn't even know what was a PP, like personal protective equipment. So what kind of PP we need to wear, and how do we triage, and how do we segregate the patients? We didn't know how it was.
Okay.
But somehow, in course of time, we learned a lot in the first wave. But unfortunately, we lost many patients. That was really very traumatic for us, first wave.
Okay.
And still, we could. 2 months were very hectic, and luckily, like my staff was spared. None of us got affected very seriously, nor our family members, like
Okay.
at least. But we lost a lot of patients.
Okay.
Then we came out of it. Slowly it reduced. After 2 months, it slowly, gradually reduced.
Okay.
Then came the second wave, which was really pathetic.
Okay.
In like the ground level, what we have seen, it was the most dangerous wave we have ever seen in our lives.
That was the second wave.
Second wave was considered to be very dangerous because we have seen healthy people losing their lives.
Youngsters. mostly.
Youngsters, 35 to 40 years of age, and we couldn't do anything. You know, we were losing them in flash, and it was really, I don't know how we came out of it. Like we were, my doctors, my team, we were all mentally drained out. So we were not sure that whether we are going to survive this, or it was like that. Then that also we could cope up, luckily, with God's blessings and all. Our team were, but we lost a lot of our loved ones, near ones. Second wave, it was very traumatic. People were telling us to prepare about this third wave, and it's going to be more very dangerous.
Right.
But fortunately, we are very fortunate that third wave is very mild. So, and in this wave, all of us, like my doctors, my nursing staff, housekeeping, everybody got affected, but we all came out of it. It's not like not even one person was spared in this wave. And but we are wishing that everyone should get in this wave so that they get antibodies, and then that will be very nice for them. So this third wave is really very mild, and we are really happy about it. Now every second person is having COVID, but we are not scared about it right now. We are not losing anybody this way.
Government has declared a status where they call it the third wave has come to an end. It means what? We should be ready for another wave, or do you want to say that there is nothing of something, nothing such?
Sir, I don't want to think about another wave because we are totally exhausted with all these waves. And even we feel that it has come to an end, or it is coming to an end. That's a good news. But I don't know. There are a lot of rumors of new strains coming. I don't know. That is all in the media or something. But now, if we just compare from the previous times and all, you see the number of cases declining, right? Number of cases
Okay.
more, but everybody is having a milder form.
Okay.
It is more. It's too much.
Okay.
The cases are like every second case is COVID. But the thing is, it's like just a flu which everybody gets. It is very contagious this time. The best part is just it takes for 72 hours for the patient to recover.
Okay.
And requires isolation.
Looks like everybody has got
everybody
good
is
immunity.
Yes.
I mean, this
Sadly
period
contagious.
of all these 2.5 years or 2 years, we have seen, like, what do you say, like, people have got good immunity for this virus?
Good immunity in the sense I can't say exactly, sir, because in second wave we have seen very good people losing their lives. I don't know. I mean, because we have seen athletes losing their lives. And youngsters 35, 40, and we have seen elderly people who are having multiple problems, they recovered in second wave.
Okay.
So talking about immunity, I'm not sure about it.
So it is very uncertain, you mean to say that?
Uncertain.
Okay.
It is really uncertain because second wave it was totally a different scenario. In third wave though, we haven't seen anybody becoming serious. So all are like
so in this third wave, like, you have not seen any?
No, even elderly patients with multiple problems.
They recovered very well.
Yes, it's
they
not
recovered
at all,
very well.
Any life-threatening for them.
Okay.
Unless and until they have multiple other serious issues, then that's a different thing. But we haven't seen.
What do you think, ma'am? This vaccine is working?
Vaccine, yes, it might have worked. That's why I guess third wave was like this.
Okay.
But booster dose, we have to wait.
Is it the vaccine due to which people had that milder symptoms, or is it the virus itself was, not really very violent, or?
I don't know, sir, because first wave we never took any vaccine. We didn't have any vaccine. Just before the starting of the second wave, we took vaccination.
Right.
For the vaccine to act, at least it will take, I guess, maybe 1 month or 2 months, something like that. So by the time we got the second wave, and it was a serious form.
Okay.
And then slowly when the people got vaccinated and all, then third wave, you can see that people, how we are responding. The researchers should say that whether it is a vaccine or...
Yeah. And now many people are taking this booster dose and
Booster dose is recommended only for people who haven't got COVID this time, third wave.
Okay.
Otherwise, I think everybody has acquired COVID in this
See
way.
that majority of the people across the world
Mm.
have taken booster dose, and in our country the government has also given some good
Yes.
guidelines that they can just go and take good amount of vaccines in the form of what you call preventive dose. Some people call it preventive dose and some people call it a booster dose. What do you advise, ma'am?
Booster dose is advisable, but for example, me, I've taken booster dose, and on the third day I got COVID.
It
No,
was a very
because-
unfortunate thing.
No, for the booster to act, at least it will take 4 weeks.
Right.
So in that 4 weeks, I don't think so anybody can escape with COVID.
Yeah, no matter what, you have to take
Yeah, because
vaccine
as I
and
said,
you have to
yes.
follow the protocol. That's what you would like to recommend,
Yes,
right?
I will recommend that, but it will take 4 weeks.
Okay.
And once you get COVID, then that is recommended after 3 months.
Ma'am, somebody has some fever, some throat pain. People are little scared. What do you advise? Should they check their temperature along with their pulse oximeter? What do you advise them, ma'am? Because since you are a emergency physician.
Yes, sir. In this way, we are just checking the temperature
Okay.
of the patient, and then oximeter, yes, saturations, but none of them have shown low saturations,
Okay.
which was termed as happy hypoxia in the first wave and second wave.
Okay.
Happy hypoxia means the patient is having low
saturation, but still he
the
is
patient-
asymptomatic.
Yes, that sign we didn't see in this wave.
In this third wave.
This third wave, we just saw that the patient is having high grade fever and they're dehydrated or they're becoming very weak, myalgias and all. But we have not seen hypoxic patients. So we just asking them to check the temperatures, eat well, take a lot of fluids, take rest, isolation, and that's all we are advising them in this third wave.
Okay. Ma'am, how about these antibody, these cocktails and all? You people have been administering, right? In the OPD
no.
and in the emergency.
No,
So that antibody
antibody
cocktails and all. You don't recommend?
I'm not the right person to tell you, the pulmonologist can tell you, but all the patients, whatever we have seen and advised, and my staff, and we have just taken supportive symptomatic medication. That's
Okay.
all. Antibody cocktail, that is a special remdesivir and cocktail. I think there's a special criteria.
Okay. The
Like if
pulmonologist.
after the 7th day, if they have still high grade fever and then cough is persisting, then CRP is still elevated, then this remdesivir they are giving, and like that.
Lastly, ma'am, could you just tell our people what is the right time when they should come to the emergency department?
Sir, they should come as soon as possible.
Okay.
Okay, even on the day one, if the patient has got high fever, don't neglect.
Okay.
Just seek medical help,
Okay.
because prevention is always better than cure. So people think that just fever it will go off. No, but seek medical help. I advise everybody.
Okay.
That is the thing.
Okay. So, thank you so much, ma'am, for sparing your valuable time for our viewers. And I hope that I will soon catch you again
Yeah,
with
sure, sir.
what you call maybe another branch or another part of medicine which you deal with, maybe cardiac problem or maybe heart failure.
Yes, sure, sir.
So this was Dr. Seema from Emergency Department of Care Hospitals, Nampally. Thank you so much, ma'am.
Welcome, sir. Thank you.
Welcome to Med Talks with Dr. Moin.